Mr.
Thank you, lady. Good morning, lady. Dr. Perumal, we have just finished dealing with your CV and spoken a little bit about post-mortem and autopsy artifacts. There's one question I didn't ask you, and that is, have you any experience of performing medical legal autopsies, first, second, or whatever, in hanging cases?
Most certainly, my lady. Hanging as a form of death or cause of death is very, very common in the Devon environment. It's probably the commonest means in which people commit suicide.
Are you able, and if you can't, that's fine, are you able to put a number of how many autopsies you might have been involved in cases of hanging? Are we talking about 10 or 20, or can you give a guesstimate?
Yes, my lady. It's difficult to put a number to it because I think at this stage in life we no longer count the cases that we're doing, but I'll say it will be definitely more than 100, if not a few hundred.
Now, we have on record the post-mortem examination report that was produced by you after the performance by you of the second autopsy in this case. It was handed in by my learned friend, in fact, and you performed that on the 1st of August 2016, and it was handed up as exhibit number E. You have that with you?
Yes, my lady.
Now, just for the record, that was handed up by you, or that was produced by you, and it was made available to the state by the defense at the time of the bail hearing in this case. You're aware of that, I'm sure.
That's how I understood it in this proceeding.
It took 7 months after that for the state to make its autopsy report available to the defense. But that you perhaps wouldn't know exactly, but it's a matter of record. You produced this autopsy report without having had sight of the state's autopsy report. Is that correct?
That's correct, my lady.
Right. Now, I think it's common cause that you performed the second autopsy on the deceased in this case on the 1st of August 2016 at the request of either Mr. Rohde or his attorney of record, Mr. Blitz. Is that correct?
That's true.
Are you aware that, in fact, prior to you being requested to perform the second autopsy, that Dr. Patricia Klepp, forensic pathologist, had in fact been requested? She had then had a conversation with Dr. Cahn, and after that she had declined to become involved.
I am aware.
Right. And then you were approached.
That's correct.
Okay. Prior to performing the second autopsy, we have on record that you had a conversation with Dr. Cahn. Can you just tell us a little bit about that conversation, and in particular who initiated it?
Yes, my lady. I personally had called Dr. Cahn. My lady, I had indicated yesterday it's always best to do the autopsy jointly, but if it's not possible, then if I'm doing a second autopsy, I'd like to invite and have a discussion with the first pathologist, which is what I did. I then got on telephonically, got on with Dr. Cahn, and in my discussion with him, he described some of his findings with me.
Before you go further,
Sorry, are you going to refer to the photographs of Dr. Perumal at the moment? Because the court order you would like to pass it on to me if you are.
my lady, the photographs that we handed up, made by Dr. Perumal and discussed with Dr. Cahn in his cross-examination, were just some of the photographs that were selected. I'm going to hand up the full photo album of Dr. Perumal as a separate.
Thank you.
Did you invite Dr. Cahn to attend the second autopsy?
I did, but I must say that I understood that he is in the Cape Town, is based in the Cape, and the autopsy was being done in Johannesburg, and I understood that he wouldn't be able to come, but I still did extend the invitation, as is my standard practice.
Right. And then you had a discussion with him. Can you just briefly tell us what information he gave to you?
My lady, yes, he indicated that he'd been to the scene of death. He'd done the autopsy. And one of the findings that he made was that there was a fracture of the hyoid bone. And that he did make some findings about some bruises in the area of the neck. But that he hadn't yet completed his report at the time, hadn't signed it out.
Right. Anything else of significance that you can recall in respect of that conversation?
Yes, he also said that he did some preliminary drug screen on the urine, which was negative.
Now, we have on record that drug screening test kit pamphlet, so I don't need you to go into that in any further detail. That will be a matter for argument, and I will deal with drug screening with you in terms of your autopsy. You then performed an autopsy, not so?
That's correct.
And pursuant to that, your basic report was produced, and that was handed in as Exhibit E, not so?
That's correct.
And Exhibit E comprises your schedule of observations, your essential conclusion as to the cause of death, and attached to it is also an histology report, and I understand that you took sections of certain organs and parts of the body and examined them histologically.
That's correct.
Right. Just for the record, you are a registered specialist forensic pathologist, or you are a registered specialist anatomical pathologist or histopathologist?
No, my lady.
Right. Now, the essential finding of your histology was non-specific multi-organ congestion. Is that a fair comment?
That's correct.
Right. Now, we also know, it's a matter of record, and attached to your report, in fact, is an image. I think it's from a so-called CT scan of the hyoid bone.
That's correct, yes.
What special investigations did you conduct in respect of the hyoid bone? And why?
My lady, when I performed the second autopsy, I noticed that there was a hematoma on the inside of the hyoid bone, the inner aspect.
The hematoma being a
collection
spot of
blood,
bleeding.
a spot of bleeding.
Sorry, repeat that.
A hematoma, spot of bleeding. On the inner aspect, the hyoid bone is a U-shaped bone, and it was on the inside of it, not on the external surface. And the hyoid bone was intact. In other words, it didn't demonstrate any fractures. Neither was there loosening at the joints.
Can I just get clarity? The joints of the hyoid bone.
That's correct. It's not a single bone. It's made up of essentially 5 bones together.
And they are joined with...
At the joints, they attached at the joints. And sometimes there's not a fracture, but there may just be loosening at the joints.
But you found neither a fracture nor a loosening at the joints.
That's correct. Macroscopically, naked eye.
Right. And that came against the background of Dr. Cahn having told you that he had diagnosed a fracture of the hyoid bone.
That's correct, my lady.
So what did you do?
My lady, I subjected that. I took it with me.
What?
The hyoid bone. I did not return it to the body. I took it as an exhibit. To a firm of radiologists in Durban. Subjected it to an X-ray. And the result was that it was entirely intact without any fractures.
Before you go any further, I just want to get clarity. When you say you had it X-rayed, was it X-rayed? Was it CT scanned? Was it X-rayed and CT scanned? Okay. Can you just explain
I'll explain that. My lady, the first investigation was an ordinary or a simple X-ray, as we know, an X-ray examination. But because it showed no fractures, I then contacted the instructing attorney, Mr. Daniel Witz, and requested his permission to then proceed to the next level of radiological investigation.
What did you say to him? What was the purpose?
I explained to him that the hyoid bone, upon the X-ray examination, showed no pathology.
But what was the significance of that from his point of view?
Whose point of view?
Mr. Witz's point of view. What was the point of you saying that to him?
The point of saying that to Mr. Witz was to firstly convey my finding on the initial investigation, and to get authorization, in a sense financial authorization, to proceed with the CT scan. And the CT scan examination, my lady, definitely is a very superior radiological investigation. In the sense that it confirmed that there were no fractures, but very importantly, excluded joint pathology. So that, in a nutshell, was the specific investigation that was done subsequently on the higher point. There were other investigations that I did.
We'll get to them. So when you say excluded joint pathology, I just want to get absolute clarity as to what you mean there. Anything wrong? Are you saying it excluded anything, any injury or anything wrong with any of the higher bone joints?
Yes, in other words, there was no increased separation at the joint, there was no fluid pathology. They were absolutely normal.
Right. So, far from there being a fracture of the hyoid bone, as told to you by Dr. Cahn, there was nothing wrong with it at all.
No. There was a hematoma or a bleed on the inner aspect. Apart from that, there was nothing wrong with the hyoid bone.
What did you do with the hyoid bone?
I kept it as an exhibit.
Do you still have it available if necessary?
That's correct, my lady.
Apart from the histology that you performed, and we're going to get to that in detail in a moment, what other special investigations did you perform or tests in respect of the body of the deceased?
My lady, I retained a sample of blood which was taken from the femoral veins in the thigh. And I had that subjected to specialist toxicological analysis.
In a laboratory?
That's right. With the request two specific requests, my lady. The first one was presence of alcohol, which is standard in all our medical legal cases. We look for presence of alcohol. And the second request was for essentially looking for benzodiazepines and zolpidem, which are anxiolytics, for use a broad category. So that's the other investigation post-autopsy.
Right, let's deal with the results of those investigations. What was the blood alcohol report?
0.03 grams alcohol per 100 mils of blood.
Now, if we could pause there, while we're on that point, we know that the blood alcohol level was also tested by Dr. Cahn through a specimen that he drew, and that his result was 0.05% grams per 100 ml. Can you account for that difference?
Yes, my lady. The first account could be a post-mortem change in the level, in the post-mortem interval.
In other words, between the first and the second?
That's correct. And the second could be, which I doubt, but it could be different standards of analysis in the two laboratories. I'm just giving that as an answer, but I don't think it's the cause of the difference.
Okay, so you would account for post-mortem changes during that interval?
Yes, if I'm asked which level would I rather accept and work with, I'd work on the result of the sample taken at the first autopsy.
At an earlier stage?
At an earlier stage.
Right. Do you know, or have you ever heard of the drugs Urbinol and Stolnox?
Yes.
Into what category of drug do they fall?
My lady, Urbinol, the active ingredient of Urbinol is clobazam, C-L-O-B-A-Z-A-M. It's a benzodiazepine. It's a big class of drugs called benzodiazepines, and one of the benzodiazepines is clobazam, known
Commercially?
commercially as Urbinol.
Yes.
That's one. Now, zolpidem is also known as Stilnox. Zolpidem is not necessarily, it's not part of the benzodiazepine group. It has to be tested separately.
Now, the test that you requested here included benzodiazepines.
Definitely included benzodiazepines and also specifically Zolpidem.
Right. And what did the report reflect? Was any such drugs as Ergonol or Stilnox found in the patient's, in the deceased's blood?
My lady, the report says not detected.
Right. Did the report also check for metabolites of those drugs? I mean, did the test check for metabolites?
That's a standard test. Not just a parent drug, but metabolites.
And
I assume that because it's a standard, that it would have been done, but it says
Okay.
not detected.
right. Do you know what the half-life is of those two drugs, Ergonol and Stilnox?
No, my lady.
Okay. I'm not going to ask you further about them, then we'll deal with that with our psychiatric expert. So to sum up, you produced this post-mortem examination report, which we have in front of us as Exhibit E. You took a whole lot of photographs of the deceased, etc., not so?
That's correct, my lady.
You performed histology where you felt it relevant at the time when you did the second autopsy, and you performed the special investigations that you described to us, namely the X-ray and the CT scan of the hyoid bone, which you kept and is readily available today, and you also did those drug and alcohol screening tests. Is that a fair comment?
That's fair, my lady.
Right. Now, the more relevant of your photographs were put to and discussed with Dr. Cahn during the course of his cross-examination. But I have here what I would call an album that you've handed me. Photograph album, post-mortem pictures. My lady, may I beg leave to hand up this to the learned court?
Thank you.
Just trying to sort them out. If you could hand that one up to the court, please. And do you have a copy of the album there, Dr. Perumal?
Yes, my lady.
Now, these are the photographs that you took, as I understand it. Is this the entire album that you took of photographs?
This is the entire bundle of photographs as I have it, yes.
Okay, my lady, if I may hand that up, please, as the next exhibit in this case, which I think is Triple H, is it? Thank you, my lady.
So much.
Dr. Perumal, just for the record, so that there's no problem afterwards, who took these photographs?
I took them.
You took them personally.
That's correct.
Right. And you can confirm, no doubt, that these are photographs that you took of the deceased, in this case, or parts of the deceased's body.
Yes.
Okay. Now, you were requested specifically last year to attend various portions of the court case, and in particular to attend the testimony and cross-examination of Dr. Cahn and Dr. Abrams. And on one or two occasions when you couldn't attend, you were provided with the transcript of evidence. Is that correct?
That's correct, my lady.
Okay. In fact, have you been provided with an entire transcript of all the evidence and exhibits in this case to date? I know that we haven't had the transcript from this week yet, but other than that?
Other than this week, right up until last Thursday.
Right. And you have attended court this week in person during the past 2 days, not so?
That's correct, my lady.
Okay. And pursuant to all of this, is it correct that you were requested to prepare a brief report essentially summing up all of these investigations and observations and findings that you made, and that if I could show you a document here, and you could just confirm that this document is in fact the report that you finalized or finally approved yesterday after we had consulted with Mr. Rohde after his testimony ended.
That's correct.
Thank you, my lady. If I may hand up this report to the learned court and request that it be marked as the next exhibit. I presume that's JJJ. Now, just for the record, this report essentially summarizes your findings as contained in your photographs, your autopsy, your special investigations, and your observations during particularly the testimony of Dr. Cahn and Dr. Abrams. Is that a fair comment?
It's a reasonably fair comment, but I've elected not to go into the detail, lots of detail, in terms of the areas of the testimony of Drs. Cahn and Abraham.
Well, maybe I can interrupt you there. It can't be lost on you that Dr. Cahn, with his 2 years of experience as a specialist when he performed this autopsy, that he criticized you roundly. At one stage, he's on record as saying, what sort of an autopsy is this? Both in terms of your competency and the quality of your autopsy. Amongst other things, he accused you of totally missing a fracture of the left, I think it's the left horn of the
thyroid cartilage.
Thyroid cartilage. You recall all that evidence?
I do, my lady.
And you will no doubt recall Dr. Abrams's evidence, who in no uncertain terms indicated that your input in your work should not be accepted, that you were in effect a hired gun. Because you were being paid, no reliance could be placed on your report, which was misleading and no doubt influenced in favor of the deceased. Pardon me, the favor of the accused,
yes,
or his legal team. Would you like to comment on that?
Yes, my lady. I have done many, many, many cases, both in South Africa and Southern Africa, where I testified. I don't know the original author. It's a French author in the early 1900s that, when I paraphrase, says, I may not agree with you, but I'll defend to the death your right to disagree with me. That was used many, many times by Winston Churchill, Mahatma Gandhi, etc., many people. I will respect any colleague who holds a view different from me. And they have a right to do that. But I would have appreciated if a colleague of mine had used science and logic and found the basis on which to disagree with me, and not take it on a personal level. And I think with my experience in giving evidence, worked with very senior people.
You mean medical colleagues?
That's correct. This was the first time I've encountered such comments.
And you have, what did we work it out, 28 or 29 years experience as a specialist forensic pathologist
That's
under the belt?
29 years as I speak here today.
Now,
Might I add that I heard those comments, but I'm not going to reduce myself to personal comments.
thank you. Now, your findings as set out in Exhibit E, in other words, your initial post-mortem examination report, as supplemented, if I could use that term, or complemented by your photograph album and your special investigation results. Do you confirm that, correctness of that from your point of view?
That's correct.
And the same for your report, Exhibit JJJ, which was essentially prepared with the assistance of this Honourable Court.
That's correct.
Okay. Now I want to go through your post-mortem report first, if we may. I want to then go through your photographs. At that point, we'll probably ask for a short adjournment if it isn't tea time, and I'm going to bring in a model, and I'm going to ask you with a black Koki pen, if you could, to draw on the neck of the model how you see this ligature as having been positioned. And then we will turn to your report and the conclusions and the issues raised in that. So, if we start with your exhibit, what is it, E?
That's right.
And if we go to the page 3 of that, the schedule of observations, I think what I'm going to do is I'm going to read it paragraph by paragraph and then ask you to comment on various things. If there is any possible controversy or difference of opinion. Okay?
And before I proceed, I'd
Yes.
like to make a comment, my lady, is generally, nationally and internationally, accepted that this is a report on a post-mortem examination and it should detail the factual observations. As forensic practitioners, we try to refrain from putting too much of opinions, because this is not a medical legal opinion report. This is a factual documentation of what the findings are that are made at the time of the exam. That's why it's called an examination report, a post-mortem examination report. I'm not saying that there's absolutely no room to express an opinion, but maybe we are too cautious, my era of colleagues, in the sense that we need lots of information before we make an opinion, not just the factual finding, excuse me, that are made at the time of the examination. Because you'll often be proven wrong when more information becomes available. So this is detailing primarily a factual observation, and I know that one of the criticisms leveled was I wasn't giving an interpretation, why am I not explaining this or that, but this is simply a factual documentation of the observations.
Right. Now, before we go on with it, then, I want to pose another question to you. Have you ever, in the course of your professional career in the field of forensics, had occasion to conduct an incident scene investigation, an alleged crime scene investigation?
Many, many times, as I indicated yesterday, my lady, when it came to the case of Mr. Mido Masia, the turning point in that case was my visit to the scene. And most times, most of my colleagues and I do what we call a retrospective scene visit. We very rarely go to the scene before the autopsy. Not that we don't, we do, but it's not common. Most common is the post-autopsy visit to the scene.
Right. Now, let's just picture the scenario of a pre-autopsy visit to the scene of death. How does a specialist forensic pathologist appropriately approach that investigation on the scene? What is the state of mind involved, or should be involved?
Lady, I think I know what the question is that is posed to me, but I'd like to say something before I answer the question. I want to be able to leave this court saying I've put a few things into perspective. The first thing is, my lady, when an expert or a specialist is called to a scene, one has always got to ask, what is my purpose there? My lady, the teaching is to do as little as possible and say as little as possible. As your primary purpose is to determine the time of death.
That's of a scene investigation.
Yeah, that is a pre-autopsy now.
Yes.
Primary purpose is to determine the time of death. I'm not saying that other things are unimportant. That is the focus. I myself and many other people fully aware that an autopsy will be done, and it's usually the next day, sometimes the same day, but usually the next day. So if I visit the scene today, I'll schedule the autopsy tomorrow. And usually, not always, but usually there's a lot of other people around who are non-forensic pathologists. So I will say very little because I am going to do a full, thorough examination of the body where I'll undress the individual and do full external and internal examinations. So I refrain from giving any comment on what I think is the cause or the manner or the mechanism of death at the scene, because that's not my job at the scene. I'm not saying that people don't do it, but there will obviously be errors in that, in rushing there. So the main thing for me is to establish the time of death in a pre-autopsy scene visit. Might I say that my experience is I get far more information when I visit the scene post-autopsy, because I now have information from the autopsy. Lady, I will give you an example, and I mentioned one of them yesterday, in the case of State versus Oscar Pistorius. After the autopsy, we were prevented, as the team engaged by the accused, we were not given access to the scene for 5 days. But because I did the autopsy and I understand the pathology or the gunshot wound sustained by the deceased, when I went into the scene, when I went to the house, I could immediately tell that there was a spent projectile sitting in the toilet bowl. And that was retrieved by me. Even though the police had the scene for 5 days. And the reason that happened is because I understood the injury sustained by the deceased and the directions of the shots. I could easily say there is a spent projectile still sitting in the toilet bowl. Now that's the value of having done an autopsy first and then going to a scene. So for me, post-autopsy scene visits are absolutely important.
Just from the point of view of visiting a scene of an alleged crime or a scene of a death, one of the points that I put to Dr. Cahn in cross-examination was that he made the fatal error of reaching a premature conclusion. Can you discuss that as a general principle or comment on that assertion that I put to him?
Lady, as I said earlier on, we are trained to refrain from trying to find or make a finding on the cause or the manner or the mechanism of death at the scene. Because once you get locked into a view, it's very difficult to entertain something else. The intention is to just keep an open mind and start formulating cause, manner, mechanism of death at the autopsy.
Okay. Now let's go to your schedule of observations, and you're welcome to refer to your photographs in the photograph album exhibit HHH at the same time if you want to.
Yes.
Now one, general physique, average built, nutrition good. Don't think there's anything contentious about that, is there?
No.
Then you say special identifying features. Brown board was attached with a black cable tie onto the right lower leg, and it contained the following information: WC/0256/16, 52 kilograms, 1.71 meters, inverted U-shaped 83 millimeter scar on the right knee anteriorly, 35 millimeter linear scar on the interior aspect of the right breast, white plastic band on the right wrist with details, Jason Rohde 005746. Could you just discuss those?
Yes.
Those observations or identifying features as you've described?
Yes. My lady, what I'm going to do to assist the court, for every finding that I have, I've photographed it. I'll make cross-reference to the album, which is Triple H. Now, the photograph number 1 on Triple H is simply the facial features, so we know who the photographs relate to. There's nothing much to talk about on photo 1, simply saying that's the facial features of the deceased. Photo number 2, paragraph 2, my lady, the brown board. One can see on photo 2 there's a cable tie. Unfortunately, because it's wet, it just broke off upon turning the body. And that's the board that was attached. I think that comes from the mortuary, the forensic facility. Number 3, photo 3, is the inverted U-shaped scar on the right knee. It's an identifying feature. That's all that it is. Number 4, it's very faint, photo 4. My lady, it's a picture of the right chest, anterior chest wall. One can see the breast. There's a nipple right on the top of this picture. And if I can just point, my lady, without, there's a scar there, that's all. She may have had some minor procedure to the breast. All this is still paragraph 2 of the report.
Photograph 5.
Then the last bit of paragraph 2 is photo 5, and that's the white band with the name of the deceased and a number. That's a number that is given by the mortuary doves. The blue board on top is my handwriting with the date and the name of the deceased.
Let's move on to paragraph 3 of your report.
My lady, I said it's a well-preserved, refrigerated body of an adult female, and sutured autopsy incisions were present on the head and the neck and the body, and the rest of the photos here showing it. For example, photo number 6 shows one aspect of the post-mortem sutured incisions. All the organs had been removed at the first post-mortem examination. And I commented that there was a specialized neck dissection conducted at the first post-mortem. And the last line there said there's also a sutured incision on the right side of the neck laterally. Now, what I said there is 13 millimeters long, and it's probably a post-mortem artifact.
Could you just point out what you're referring to there?
That's photo number 6, my lady, if I can just hold this up. That is the post-mortem incision that is sutured. I'm now referring to
The little
the little
sutured incision.
That's right. Just to the left of the picture that we're looking at, of the main sutured wound coming down. Now, why I thought it was a post-mortem artifact, because part of the dissection of the neck is to try and take that flap more lateral.
Yes.
And not uncommonly you get an incision that goes through the skin. It just happens depending on the experience of the examiner. That can happen.
So just referring back to your definitions at the beginning of at the end of your testimony yesterday, would that more correctly be described as a post-mortem artifact or an autopsy
It
artifact?
should be it is still a post-mortem, but more specifically an autopsy artifact.
Right. In other words, caused during the process of performing the autopsy.
That's correct.
Okay. Just while we're on photograph 6, and this is a photograph that has previously been handed up as part of the cross-examination of Dr. Cahn, you will see on the left, in the middle of the neck there, obviously the hair is now lifted up.
Yes, I lifted it up, yes.
Right. Would you just deal with that while we're there, please?
So
Those-
the photo you are now?
Photograph 6, my lady. Those marks there.
Sorry. My lady, I'm sure counsel is asking me to comment on the mark on the back of the neck. They are parallel linear abrasions or tram line abrasions, if you want to call them.
Yes.
Tram track abrasions, 5 millimeter wide. So we're seeing it not from the back of the neck now, we're seeing it more from the right back.
Yes.
It's not lateral view, it's not a posterior view, it's a posterior lateral view combination. And when one looks at it, my lady, and again, it's definitely an abrasion, but there is an imprint of it tending to rise or go upwards on the right side.
Right. Let's go to your report, paragraph 4, external appearance of the body. And there you say, well, perhaps you can take us through this.
Okay. There's a ligature imprint, almost circumferential around the neck. It wasn't complete.
Right.
Almost circumferential. The imprint was for the most part comprised of centrally blanched. Blanched means the blood is displaced. It's appearing white.
Yes.
Averaging 5 millimeters wide. Parts of those blanched areas had hyperemic area. Hyperemic means more red or reddened areas.
You said actually associated hyperemia.
Yes. Above and below the blanched areas.
Yes.
My lady, one can see that in photo number 8 of exhibit H. If one looks at that, it's anterior part of the neck, my lady, but I'm not talking about the orientation. Simply to say there's a blanched area, but you can see there's a redness above and below that blanched area. That's the point I'm making.
Yes. And you say, yeah, the imprint
The imprint anteriorly on the front of the neck was sloping upwards and to the right of the deceased. Again, one can see this in photo 8 of Triple H. imprint on the back of the neck was almost transverse but sloped upwards towards the right. Now let me find a picture of the back of the neck. Photo 14, my lady.
Can I just get the court order's attention? Jason?
Now, if one looks at the
Sorry, you're now on photograph number?
number 14 was showing the back of the neck. So my lady, if one looks at from Triple H, from number 7, photo 7, one can see the blanched area. I'll point it, my lady. You can see it sloping up. It's going towards the ear. Number 8 then shows, I've left the right side of the neck. I'm now coming to the front. And then we see number 9. The blanching now is more prominent in the front and to the right, but as we're going to the left side, we can see that there is some friction area. There is some area that is red and felt a little bit leathery. Number 11 can show, it's a direct view, my lady, from the front, exactly from the front, and one can see clearly there's a rising up towards the right, and one can see that the ligature imprint has a different nature. Right of midline versus left of midline.
Midline being?
The front. Number 12 shows again the ligature imprint on the lateral aspect.
The left side, yeah.
Left side, yes. (14) is at the rear of the neck. And 15 shows the imprint on the right rear, almost sloping up towards the ear. Now, I did make a slight comment there that the lack.
Where are you now?
Sorry?
Where are you now?
I'm still in 4.1.
Right.
I said that the lack of the friction abrasions related to the ligature and the lack of associated oozing of serous fluid. Now, let me say that the commonest ligature that we find in suicide lying is normally a rough rope, with a rough surface. And what happens when you have an object that is rough? With this movement, the skin gets abraded. An abrasion, my lady, is removal of the superficial layer of the skin, the epidermis. Then, once the top layer is removed, you expose the underlying tissue, the serous fluid is present. When that dries out, it creates a leathery, parched appearance.
The explosive underlying.
Soft tissue, in other words, on the skin, subcutaneous tissue.
Thank you.
Now, my lady, I know that counsel is leading me with the question, but I'd like to just explain something so that we understand the findings, what I would call the pathophysiology in hanging. What happens in a person who hangs himself? Because then we will begin to understand the ligature imprint and any other injury that may be present. My lady, just to summarize it, in the process of hanging, with the structures in the neck, the main insult is deprivation of oxygen to the brain. Various terms can be used, and you can use them interchangeably, whether it's asphyxia, anoxia, hypoxia. The terms have been used in this court, but that's really, all that it's saying is that we got a decrease or a complete cut of oxygen supply to the brain. My lady, there's various ways, there's various mechanisms by way that happens in a case of hanging.
Various possible mechanisms.
Yes. And to predict which mechanism is operative in a particular case is not easy. So, my lady, if one looks at research in this regard, unfortunately, it will be very, very difficult to get an ethical approval to do human studies on the pathophysiology. Unfortunately, that was done in an era during World War II, but that research is not going to be used because of the way in which it was done by the Germans. So our information comes mainly from rats and dogs. But of recent, my lady, with the use now of cell phone technology, etc., more and more we're having people filming their suicide, their hanging. And the French Canadians have basically started a group called the Working Group on Human Asphyxia, a study group. To show, and for us to understand better in the human subject what happens. And What they've done is they analyzed a series of these videos. And it was a surprise in terms of putting the information together that there's a rapid loss of consciousness as early as 8 seconds. And then as early as 10 seconds, my lady, there's convulsions, because the brain's response to oxygen lack or deprivation is seizures. Because that's the insult of the oxygen lack, and the brain responds with the convulsions. And that's as early as 10 seconds and up to 19 seconds. So in that period of 10 to 19 seconds, convulsions set in. My lady, that's manifest in what is called decerebrate rigidity. That's where the limbs extend. Decerebrate rigidity.
Just put that in layman's terms. Decerebrate, what is
Decerebrate means it manifests with the limbs, all the joints extending. The limbs, upper limbs, lower limbs, and the back is straight. It extends. The joints will extend.
Right.
Followed by, again, decorticate, where there's flexion. So it's basically that movement with very deep respiration.
Well, you're demonstrating limbs flexing and extending.
All the limbs flexing and then extending. So it's decerebrate and decorticate.
Is it a one-off or is it an ongoing
No,
process?
it's convulsions.
I must just finish my question before you answer.
Yes.
Otherwise the recording won't take it up. So I just want to repeat that question. Is it a one-off thing that there's one flexion and one extension? Or does it happen more than once?
It's more than once. It's continuous.
Thank you.
And then after that, my lady, after this period of convulsions that starts as early as 8 seconds, on the average, just over 2 minutes that happens. And then the body is flaccid. Flaccid means weak, it's got no
Muscle tone.
muscle tone. There's the odd, isolated movement that was observed thereafter. But then before 3 minutes, that's it. The person's dead. There's no movement.
Right, carry on.
Now, the reason for explaining that, my lady, is twofold. One is, depending on the environment in which the individual is, with the movement, convulsive movements, a person can strike something and get an injury on the limbs. So, oftentimes when we asked to review an autopsy and say, but this person's got these injuries on the limbs, well, that's the explanation. And my lady, if one looks at now the ligature around the neck, and with the movement of the head and the body, there's going to be a fair amount of traction at the level of the neck, both at the level of the ligature and above and below the ligature.
Repeat that for me, sorry.
My lady, there's going to be traction of tissue in the neck, both related to the ligature itself, anatomically or geographically, and to areas remote from the ligature anatomically and geographically.
And as you demonstrated, above and below.
Above and below. And that'll explain why somebody may have originally hung themselves in a certain position, but at the end, because of the pathophysiology, the body could take on a very different posture at the end when the person dies.
We were dealing with the parched leathery feature
Yes.
in certain ligature marks.
Yes. Now,
Carry on.
my lady, I was indicating the pattern of the ligature in this particular case of Mrs. Rohde. It's my opinion, looking at the entirety of this, my observation, is that because the front ligature is upward and rising towards the ear, and it is, again, my view that the ligature mark at the rear is also has the appearance of going towards ear,
The right side.
the right side, I concluded, and this is not cast in stone, it's an opinion, that the most likely point of suspension would be related to the right ear. And if you look at any standard textbook, it tells you the commonest site of the application or the knot is either the right ear or left ear. That's the commonest position of the knot in suicidal hangings. Now, if one looks at that, whether it's complete suspension or partial suspension, the greatest pressure will be opposite the point of suspension. My lady, the photographs on Triple H, and I don't know what's the exhibit number for the photos taken at the autopsy. There's a set of photos that were taken at the first autopsy by when Dr. Cahn was doing it. And clearly, and if necessary we can go there, you can see quite clearly, my lady, that the deepest lesion associated with the ligature is on the left side laterally. And that clearly shows that the ligature wasn't blanched throughout its circumference. It was certainly showing some degree of abrasion on the left side.
Now, what about this parchment-like appearance? Can we get to that, please?
Yes. I'm hoping that I can recall correctly the evidence. Both Drs. Cahn and Abrams have said there was a lack of parchment.
The absence of that.
Yeah.
I can I can deal with it with you. Essentially, they said that the absence of a dry, parched, leathery-like, parchment-like texture was proof of post-mortem hanging. In other words, the staged scenario.
My lady, if one looks at the photos that I handed before the court, and if one looks at exhibit, I don't know what it is, my lady. It's the only one I have.
Yes.
But there's a photo.
That's either C or B.
If you look at 109 or 110,
Yes.
it's the left side of the neck, laterally.
Sorry, which exhibit is that?
I think that is exhibit C.
Could be.
I'm sorry, my learned friend says it's actually exhibit B.
Maybe there are a few photos in exhibit B, if I can just draw the court's attention to it. 108. One can see it's a narrow but sort of deeper as opposed to 107.
Sorry, what exhibit is that? B?
B. I'm told it's B now.
No, I don't have a photo 108.
I think I'm right in that it is actually exhibit C, my lady. Exhibit C, Annexure C, photographs 10 and 11, I think.
Lady, I apologize. This is the only one that I have.
I've got that.
Oh, you have this one?
Yes.
My lady, one can see, and I have to say, making room for changes in the few days, that I'd rather defer to the photos taken earlier at the first autopsy to show pathology. And one can see in 107, there's clearly a blanched area. But as one moves to photo 108, it's not the same. You can see it's much narrower, deeper, and clearly that is what we refer to as the leathery parched appearance.
Right, now let's just get absolute clarity on what document you're referring to. What album?
My lady,
How many photographs in that album?
well, it starts at 83 and ends at 236.
Yes.
So I don't know how many photos there are here. I'll just do the maths quickly.
I think that is part of exhibit B. But in any event, we have...
These are the photos taken at the
Right.
first autopsy.
I have it as exhibit B.
My lady, and then if you go into the next page, you've got photos 109 and 110.
In the same bundle.
That's correct, in the same exhibit, same bundle. And one can see that in 110, my lady, there's a very small area that is blanched, but the rest of them, of that ligature, imprint, has the features then of a parchment-like ligature imprint.
Right. My lady, I believe it's about 11 o'clock. Would this be a convenient time to take an adjournment?
Now, would you like an adjournment now?
I would also like an adjournment, please, my lady, if possible.
You'd like an adjournment? We can adjourn for 15 to 20 minutes.
As the court pleases.